walk into a paddock full of horses and I just feel calm. It just relaxes me. Their presence, and they're majestic and amazing, and some are little and inquisitive, and I really get a lot of joy from it.
Susie Mercker is vibrant. The energy she exudes has been hard-won. In 2015, Susie was bedridden with chronic fatigue syndrome, struggling with the poorly understood illness while raising a young child. Then she was hit by a rare condition, alopecia universalis, complete loss of body hair.
I lost my hair within 2 weeks, and then about 6 weeks later, my body stopped.
As her mental health deteriorated, Susie realised she deeply missed the connection to animals and nature she enjoyed in her childhood on a hobby farm. So she went looking for it.
Yeah.
Nearby, Michelle Rookley runs programs with horses, many that have been rescued.
It's not only the humans that are getting the healing, it's the animals. And there's something that happens there in a very interconnected, reciprocal way, and maybe that's the magic.
Susie also called on friends with a property in northern Tasmania.
We loaded up this hay last year out of the sheds.
Oh, beautiful. And you were here for that?
Yep.
Simple tasks, like feeding the animals, were part of the process that slowly helped her to heal. Earlier this year, she read about a Tasmanian woman trying to start a care farm to help people with their mental health.
I saw the article and I thought, I've got to ring her and say, do this. This is really important. We lost a friend of mine's brother to suicide 12 months before, and he was sadly institutionalised and it didn't go well. And I really believe, because I'd had all these amazing experiences with friends and family and been very well supported, and I wished that he could have had that.
Liz Everard is a mental health nurse. Both her uncle and brother had schizophrenia. Her brother died by suicide when Liz was 23 years old. She's dedicated to setting up alternative ways to support people with complex mental health needs.
The sheer frustration of having worked in a system for 15 years and having, the heartache really of not being able to provide the care for people how you would want to provide the care.
She believes a concept called care farming could be the way. It's increasingly popular in Europe, where farmers are using it to diversify their businesses.
There's 1,100 care farms in the Netherlands currently, with about 15,000 participants taking part in programs on those care farms every year. And then there's about 675, I think, in Italy. There's 230 in the UK. There's a similar number of around 1,000 in Norway, 100 in Ireland. And it's growing. It's just very popular.
Care farming is a broad concept. It could be a community garden or something more involved, where instead of checking into a rehab centre, you check into a farm, living and working on the land, and the medical care is there with you.
So that would be great.
Liz spent 4 years working at a residential care farm in her native Holland, and now wants to start one in Tasmania. It would be an accredited mental health service. People could self-refer or be referred by a doctor or service provider. A clinical team would provide medical and psychiatric care on the farm, where the guests would live for 6 to 12 months.
So great to meet you.
Liz Everard was supposed to be visiting similar setups across the world this year to investigate the model, as the recipient of the Hocking Fellowship with mental health charity Sane Australia. Instead, it's now early morning video calls.
The basis of our program is work.
Jane Lindsley is the clinical director of Gould Farm, which has been running in Massachusetts, United States, since 1913. On 300 hectares, patients, referred to as guests, work with cows, in the vegetable garden, tapping maple syrup trees, and in the bakery. Volunteers and clinical professionals are all part of what they term a therapeutic community.
One of the things that I really appreciate about working here is that, for the most part, we get to see people get better. And that's actually has not always been the case working in mental health.
It saved Jose's life.
It was not all glory. It took about 2 stays, 6 years apart to start to get better.
Jose says he was zombie-like on his first stay at Gould Farm. The second time around, he threw himself into it.
In the process, I learned how to make the cheddar cheese specifically.
Wow.
And I cannot tell you that it's 100% good all the time, but we have days that we do a great job.
Jose now works at Gould Farm as a peer support specialist. Liz Everard says care farming is cheaper than a hospital bed. But what do farmers make of it? Mandy and Carl Cooper have a foot in each camp, formerly community pharmacists, now running 1,200 Corriedale Merino cross sheep and 85 breeding cows on the West Tamar, 40 minutes north of Launceston. They agree work is part of recovery.
I think that if people have got a purpose and have got something to do that creates or helps, or at the end of the day they can say, I did that and look at the good job I've done. I think that is a really big thing.
But there are some safety concerns.
So you would have people that help you overseeing some of those activities, and those people would be trained or comfortable or skilled to be overseeing those activities.
That's really good, because that was one of our concerns, wasn't it?
Yeah.
That we are already stretched in a lot of directions, and then how would we supervise people and make it safe?
Amongst the patients who do the program, or at least work on a care farm, are the outcomes better than for in sort of traditional medicine?
They're more sustainable,
Yes.
is what I would say. People generally stay a bit longer at a care farm, so 6 to 12 months. And so they have time to work on more aspects of their life, not just their diagnosis.
Carl and Mandy Cooper say landowners would need to be sure about what it means for insurance and liability.
But if we're given the right support, and that's medical support as well as guidance in terms of the persons working there, then it's all possible. Yeah.
And it could be actually quite fun.
Oh, yeah.
It would be wonderful to see people sort of develop and recover, but it would also be an extra pair of hands around the place, and that's always really useful. But I think, to be able to help and assist somebody would be really good.
The elephant in the room is the black dog. Significantly higher rates of depression and suicide among the farming population.
I guess it's different when you are, owning a farm and running a farm and having all the, the stresses that come with that, financial stresses. We know that farming is not getting any easier, and so being there as a farmer in that ownership and in that position would be different from being a participant, in a farming program, so to say.
Liz is developing the business plan to make the dream a reality. Susie Mercker hopes it will take off in Australia, with many care farms catered to a range of mental health challenges. Meanwhile, she's paying it forward and mentoring other women. She says don't be afraid to call on those who can help.
And most people, when you pick up the phone, are pretty good on the other end.
If this story has raised any issues with you, contact Lifeline on 131114.